The National Council on Alcoholism and Drug Dependence was founded in 1944 by Marty Mann, the first woman to recover from alcoholism in Alcoholics Anonymous. Her aim was to break down the stigma and discrimination too often associated with alcoholism by developing a plan to teach people the facts about alcoholism so that families, individuals, and communities could take constructive action. Though NCADD was established with a focus on alcoholism specifically, in 1990 we expanded our mission to include drug dependence. Over 23 million people in this country over the age of 12 are addicted to alcohol and other drugs. 15 million is alcohol alone, and it results in more than 140,000 deaths per year at a cost to you and I of over $416 billion in lost productivity, healthcare costs, and criminal justice costs. As a result of NCADD's leadership and work with many other partners, it is now estimated that more than 20 million individuals and family members are living life today in recovery. Our mission and services are built on the foundation of Marty's vision, fighting the nation's #1 health problem, alcoholism, drug addiction, and the devastating consequences on individuals, families, and communities. Of the 24 million people addicted to alcohol and other drugs, only 10% receive help each year. NCADD wants your help so that we can reach out and support them and their families. We also want to prevent future addiction by providing education and prevention services to those most at risk, individuals with a family history of alcohol and drug dependence. To do this, NCADD needs to expand our national network of affiliates and our capacity to bring our message of hope, help, and healing to more individuals, more families, and more communities. We currently have 90 affiliates throughout the country, and we're striving to increase this number to 150 with an affiliate in every state. Increased funding and community-based support are essential to helping us meet these goals. With your added support, NCADD will be able to expand our ability to reach out to the public through our social media strategy and our website, ncadd.org, which already gets 2 million unique visitors. We're also developing targeted public service announcements and media campaigns, and expanding our Center for Policy and Advocacy in Washington, D.C. will enable NCADD to more effectively lead policy changes focused on investing in the solution, not the problem. Our key leverage points are our 70-year history of leadership and service, our national network of affiliates, our lack of reliance on government funding, and our growing internet and social media presence. Through our affiliates, communities are provided with education, information, and referral to appropriate services. We also offer professional training and community-based prevention programs, including presentations at schools, senior centers, and other civic organizations. This allows us to engage individuals and families in recovery, as well as other concerned citizens where they're most comfortable, and to advocate for policy changes that support prevention, treatment, and recovery. NCADD and our network is effective because we're built on a foundation of participation from members of the medical, scientific, political, social, and research communities to bring a necessary multi-pronged approach to this disease. We're also effective because of the engagement of families and individuals in recovery who are passionately committed to our mission. We have carried our message through brochures, fact sheets, public service announcements, and guides on a variety of topics such as prevention, underage drinking, prescription drug abuse, and medication-assisted recovery. For decades, NCADD has sponsored two major awareness campaigns: National Alcohol Awareness Month every April and National Alcohol and Other Drug-Related Birth Defects Awareness Week, which starts on Mother's Day in May. And NCADD has been a leader in the National Alcohol and Drug Addiction Recovery Month, which takes place every September. Each of our affiliates provide us with data, including how many people they serve. We compile these service reports into our annual publication, NCADD, A Symbol of Hope and Help, which clearly demonstrates our full reach. Because so many of our resources are online, we closely monitor the use of our website and the reach of our social media. In comparison to other nonprofits, NCADD consistently performs well above average in online engagement. Our email newsletters have a high open rate and click-through rate, meaning that our readers are interested in what we have to say and find our outreach and information useful. Many people don't know about the full scope of our mission, our history of accomplishments, and the interdisciplinary nature of our organization. Addiction is a complex, multifaceted disease, and so we provide a tremendous variety of programs to address all aspects of alcoholism and addiction. Also, because some of our affiliates have their own name, it's not always commonly known that they're part of NCADD. From a single referral for help to reaching millions with media campaigns, every individual and family matters. Last year, NCADD served 55 million individuals and their families. Each year, over 2 million unique visitors utilize our online resources at ncadd.org, and more than 10 million people visited our local affiliate websites as well. We've also reached more than 42 million people through media campaigns, spreading the word about the power of prevention, intervention, treatment, and recovery. NCADD has been challenged to help the public understand alcohol and drug addiction as a chronic disease from which people can and do recover, and as the national health crisis that it is. The very nature of alcohol and drug addiction creates societal barriers at every level: the individual, family, community, corporate, philanthropic, and governmental, as well as in the media and in healthcare. As a society, we are much more invested in responding to the consequences of addiction rather than investing in supporting the solution: prevention, treatment, and recovery. Like advocates focused on tobacco, NCADD faces billion-dollar corporate marketing and promotion efforts for alcohol and, more recently, pro-marijuana advocates. Consistent with our strategic plan, we would expand our national network of affiliates to unserved geographic regions. We would conduct public opinion polls to drive the development of national public service awareness campaigns, expand our outreach, and expand the capacity of our Washington, D.C.-based Center for Policy and Advocacy to focus on policies that better support addiction education, prevention, treatment, recovery, and research. Our primary challenge is to more effectively make people aware of our organization, our mission, and our history of leadership and service. Our resources are invested in meeting immediate demands, leaving gaps in branding and marketing. We want to make NCADD a household name and the first resource that people think of whenever they or someone they know is dealing with an alcohol or drug issue. Millions of people have benefited directly and indirectly from our decades of leadership and service without even knowing that it was us. We want everyone to know that we're their partner in solving our nation's #1 health problem, alcoholism and drug dependence.